everyone. I am Dr. Arjun Kashyap, consultant pulmonologist at Shankara Cancer Hospital and Research Center, Bangalore. So since November 18 to 24th is the Antibiotic Awareness Week, we'll have a short discussion on the use of antibiotics, or rather not the use of antibiotics inappropriately. The key word here is think twice, seek advice. Antibiotics are not always the answer. Antibiotics kill bacteria but not anxiety. Antibacterials are the most common antibiotics which are used, and as the name suggests, they are effective only against bacteria, which means antibiotics are not effective against the common cold, the flu or COVID-19. We might have seen indiscriminate use of these antibiotics during the previous COVID pandemic, something which must be controlled in the days to come if you are to not face the wrath of antimicrobial resistance. Not all infections are bacterial. A simple low-grade fever with some myalgia or body pains can just be viral, and it is important to work well with your doctor to arrive at a clear diagnosis so as to proceed with the proper treatment. Prevent antimicrobial resistance, it's in your hands. As said by the World Health Organization a couple of years ago, there is need to emphasize the crucial role of prevention and propagation of infection, like practices such as hand hygiene, not only among the health professionals but also among the general public, to prevent this rapidly progressing concern for antimicrobial resistance. Thank you.